High blood pressure, the silent time bomb inside your body. High blood pressure, a silent time bomb building up inside your body. Have you ever imagined that deep within your blood vessels there's an invisible pressure, quiet yet persistent, slowly threatening your health every single day? A tense, hidden force squeezing your circulatory system, damaging tiny vessels and critical organs without you ever noticing. For millions of Americans, this isn't just a distant warning, it's the reality they live with daily. And the condition behind it all is high blood pressure.
Hypertension, or high blood pressure, has long been called the silent killer for a clear reason. It rarely causes noticeable symptoms in its early stages. A person can feel completely fine, all while elevated pressure inside their arteries is quietly damaging vessel walls, increasing the risk of stroke, heart attack, heart failure, and even kidney failure. What's even more concerning is that many people, especially within older adults and in African American or Asian American communities, still don't fully grasp the seriousness of this condition. They may have heard of hypertension, they might even be taking their medication regularly, but they may not realize that just a slight slip, forgetting to monitor blood pressure, eating more salt than usual, or going through extended periods of stress can trigger a life-threatening stroke. Understanding hypertension the right way is one of the most important steps in taking charge of your health, especially after age 50. In the next section, we'll uncover 5 shocking but essential truths about this condition, insights that may completely change the way you think about heart health, and potentially help you or someone you love avoid becoming the next victim of the ticking time bomb known as high blood pressure. Let's begin, because no one can protect your health better than you. Fact 1. The numbers game. Many profoundly misunderstand their blood pressure readings. When your doctor or nurse wraps a cuff around your arm and tells you your blood pressure, they relay 2 numbers that are a vital snapshot of your cardiovascular health. Yet many people only latch on to one number or fundamentally misunderstand what these figures signify. Blood pressure is the force exerted by your circulating blood against the walls of your blood vessels, primarily your arteries. It's measured in millimeters of mercury, mmHg, and presented as 2 distinct figures. Systolic pressure, the top number. This measures the pressure in your arteries when your heart muscle contracts to pump blood out to the body. This is the peak pressure during a heartbeat. Diastolic pressure, the bottom number. This measures the pressure in your arteries when your heart muscle is resting between beats and refilling with blood. This is the minimum pressure in the arteries. A common and potentially dangerous oversimplification is hearing someone say, "My blood pressure is 120. While 120 systolic might sound good in isolation, it's meaningless without its diastolic counterpart. A reading like 120 over 95, 120/95 mmHg, tells a very different story than 120 over 75, 120/75 mmHg. The former indicates isolated diastolic hypertension, a concern, while the latter is within the normal range. Both numbers are equally crucial because they reflect different aspects of your heart's workload and your arteries' condition. The systolic pressure indicates how hard your heart is working to push blood, while the diastolic pressure reflects the resistance in your arteries when the heart is at rest. Persistently high readings in either or both can signal trouble. It's also important to recognize that blood pressure isn't static. It naturally fluctuates throughout the day based on activity, stress, posture, and even the time of day. A single high reading, especially in a stressful environment like a doctor's office, often termed white coat hypertension, doesn't automatically mean you have hypertension. However, consistently elevated readings taken over time under rested conditions are the true indicators of a problem. This is why your doctor will likely take multiple readings on different occasions or suggest home blood pressure monitoring before making a diagnosis. Understanding these numbers is the first step in taking control of your vascular health.
Fact 2. Beyond normal. The spectrum of blood pressure categories demands nuanced attention. Knowing your blood pressure numbers is only half the battle. Understanding where they fall on the spectrum of health is paramount. Medical guidelines, such as those from the American Heart Association, AHA, and the American College of Cardiology, ACC, categorize blood pressure to help assess risk and guide treatment. It's not a simple case of normal or high. Optimal blood pressure. Systolic pressure consistently below 120 mmGh and diastolic pressure below 80 mmGh, 120 over 80 mmGh. This is the gold standard, associated with the lowest risk of cardiovascular disease. Think of readings like 110 over 70, 110 over 70 mmGh. Normal blood pressure, systolic pressure between 120 and 129 mmGh, 120 to 129 mmGh, and diastolic pressure between 80 and 84 mmGh, 80 to 84 mmGh. While still considered normal, Individuals at the higher end of this range should be mindful of maintaining healthy habits. High normal blood pressure, previously termed pre-hypertension, systolic pressure between 130 and 139 mmGh, 130 to 139 mmGh, or diastolic pressure between 85 and 89 mmGh, 85 to 89 mmGh. This category is a critical warning sign. It indicates an increased risk of developing full-blown hypertension if proactive steps aren't taken. For individuals in this range, especially those with other risk factors like diabetes or kidney disease, intensive lifestyle modifications are strongly recommended, and in some cases, medication might even be considered. This stage is your body's yellow light, signaling the urgent need to slow down and change course. High blood pressure, hypertension. This is diagnosed when blood pressure is consistently at or above 140 mmGh systolic or 90 mmGh diastolic, according to some guidelines, while others use 130 over 80 mmGh as the threshold for stage 1 hypertension. Hypertension is further staged based on severity. Stage 1 hypertension, typically systolic 130 to 139 mmGh or diastolic 80 to 89 mmGh, using newer ACC-AHA guidelines, or systolic 140 to 159 mmGh or diastolic 90 to 99 mmGh, using older but still sometimes referenced guidelines. Lifestyle changes are crucial, and medication is often recommended, especially if other cardiovascular risk factors are present. Stage 2 hypertension, typically systolic 140 mmGh or diastolic 90 mmGh, ACC-AHA, or systolic 160 mmGh or diastolic 100 mmGh, older guidelines.
Medication is almost always necessary, often involving more than one type, alongside aggressive lifestyle changes. Hypertensive crisis. Systolic pressure higher than 180 millimeters of mercury and/or diastolic pressure higher than 120 millimeters of mercury. This is a medical emergency requiring immediate attention. Understanding your specific category is not about labeling. It's about empowering you and your healthcare provider to tailor the most effective strategy to protect your health. Fact 3. The insidious silence. High blood pressure is often a silent killer. Perhaps the most terrifying truth about high blood pressure is its stealth. In the vast majority of cases, it produces no noticeable symptoms, even as it relentlessly damages your arteries and vital organs over years, even decades. This is why it has earned the ominous moniker, the silent killer. You can feel perfectly fine, energetic, and healthy, all while your blood pressure is dangerously elevated, setting the stage for a catastrophic event like a stroke or heart attack. The absence of symptoms makes regular screening an absolute necessity. Waiting for signs to appear often means waiting too long. While some individuals with very high blood pressure might eventually experience vague symptoms such as severe headaches, dizziness or lightheadedness, nosebleeds, shortness of breath, blurred vision, chest pain, confusion. It's crucial to understand that these are unreliable indicators and often only manifest when the condition is advanced or has reached a crisis point. Relying on these symptoms for detection is a gamble with your life. The only reliable way to know if you have high blood pressure is to have it measured regularly by a healthcare professional or through consistent home monitoring. Adults should have their blood pressure checked at least annually, and more frequently if they have risk factors or previous high readings.
Fact 4. A lifelong journey. Managing hypertension is typically a marathon, not a sprint. For many individuals diagnosed with hypertension, particularly those requiring medication, management is a long-term commitment, often lifelong. This can be a difficult concept to accept, especially if you feel well. However, it's vital to understand that medication for high blood pressure is designed to control the condition, not to cure it. These medications work in various ways. Some relax blood vessels, like ACE inhibitors, ARBs, or calcium channel blockers. Some reduce blood volume by helping the body eliminate excess fluid and sodium, diuretics. And others slow the heart rate or reduce the force of its contractions, beta blockers. They are highly effective at lowering blood pressure and reducing the risk of complications, but their benefits persist only as long as they are taken as prescribed. A common and dangerous mistake is for individuals to stop taking their medication once their blood pressure readings return to a normal range. They may mistakenly believe they are cured. Unfortunately, when medication is discontinued without medical guidance, blood pressure almost invariably rises again, sometimes to even higher levels than before. Rebound hypertension, significantly increasing the risk of a sudden stroke or heart attack. Hypertension is a chronic condition, much like diabetes. Just as a person with diabetes needs ongoing management to control blood sugar, a person with hypertension needs ongoing management to control blood pressure. This involves a partnership with your healthcare provider to find the right medications and dosages, monitor for side effects, and make adjustments as needed over time. Lifestyle modifications remain a cornerstone of management, even with medication.
Fact 5. The ripple effect. Uncontrolled high blood pressure wreaks havoc far beyond the heart and brain. While strokes and heart attacks are the most notorious consequences of untreated hypertension, its damaging effects extend throughout the body, insidiously compromising multiple organ systems. The relentless force of high-pressure blood flow strains and damages the delicate lining of arteries, leading to a cascade of problems. Arteries. High blood pressure accelerates atherosclerosis, the process where arteries harden and narrow due to the buildup of plaque. This restricts blood flow and can lead to blockages. It can also weaken artery walls, causing aneurysms, bulges in arteries that can rupture with devastating consequences. Heart. The heart has to work much harder to pump blood against increased resistance. Over time, this can cause the heart muscle, particularly the left ventricle, the main pumping chamber, to thicken and enlarge, left ventricular hypertrophy. An enlarged heart is less efficient, struggles to meet the body's demands, and can eventually lead to heart failure. Coronary artery disease, where the arteries supplying blood to the heart muscle become narrowed, is also a common result, increasing the risk of angina, chest pain, and heart attacks. Brain. The brain is exquisitely sensitive to blood flow disruptions. Hypertension is a leading cause of stroke, which can be ischemic due to a blockage or hemorrhagic due to a ruptured blood vessel. It can also lead to transient ischemic attacks, or TIAs, or mini-strokes, and contribute to the development of vascular dementia, a form of cognitive decline caused by reduced blood flow to the brain. Kidneys. The kidneys are rich in tiny blood vessels that filter waste from your blood. High blood pressure can damage these delicate vessels, impairing the kidney's ability to function. This can lead to chronic kidney disease, or CKD, and in severe cases, kidney failure, requiring dialysis or a transplant. Eyes. The tiny blood vessels in the retina at the back of your eye are also vulnerable. Hypertension can cause damage to these vessels, hypertensive retinopathy, leading to blurred vision, bleeding in the eye, and even permanent vision loss. It can also damage the optic nerve. Sexual dysfunction. Adequate blood flow is essential for sexual function in both men and women. High blood pressure can damage blood vessels and reduce blood flow, contributing to erectile dysfunction in men and potentially impacting arousal and satisfaction in women. The pervasive nature of this damage underscores why controlling high blood pressure is not just about achieving a certain number, but about protecting your entire body from its insidious effects.
Taking control. Knowledge, lifestyle, and partnership. Understanding these 5 shocking truths is not meant to scare, but to empower. While high blood pressure is a serious condition, it is also highly manageable. Key strategies include: know your numbers. Regular blood pressure checks are non-negotiable. Consider investing in a validated home blood pressure monitor to track your readings in a familiar environment, away from the potential stress of a clinic. Learn the proper technique. Rest for 5 minutes before. Sit with your back supported and feet flat. Use the correct cuff size. Don't talk, and keep a log of your readings. Embrace lifestyle modifications. These are foundational for preventing and managing high blood pressure. Diet. Adopt a heart-healthy eating plan like the DASH, Dietary Approaches to Stop Hypertension, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting saturated and trans fats, cholesterol, and sodium. Sodium reduction. Aim for less than 2,300 milligrams of sodium per day, and ideally less than 1,500 milligrams, especially if you have hypertension. Be mindful of processed foods, canned soups, and restaurant meals, which are often laden with hidden sodium. Increase potassium. Potassium helps lessen the effects of sodium on blood pressure. Good sources include bananas, potatoes, spinach, beans, and yogurt. Regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise, like brisk walking or cycling, or 75 minutes of vigorous intensity exercise per week, plus muscle-strengthening activities 2 or more days a week. Maintain a healthy weight.
Losing even a small amount of weight if you are overweight can significantly lower blood pressure. Limit alcohol. If you drink alcohol, do so in moderation, up to 1 drink per day for women and up to 2 drinks per day for men. Don't smoke. Smoking damages blood vessels and raises blood pressure. Quitting is one of the best things you can do for your cardiovascular health. Manage stress. Chronic stress can contribute to high blood pressure. Explore healthy stress-reducing techniques like meditation, yoga, deep breathing exercises, or spending time in nature. Partner with your doctor. Work closely with your healthcare provider. Discuss your risk factors, understand your blood pressure readings, and if medication is prescribed, take it as directed. Report any side effects, and never stop or change your medication dosage without consulting your doctor.